5 years in, and more than 100,000 Arkansans have medical marijuana cards. And now we're learning about some impacts the drug is making in its first-of-a-kind study from the National Institute of Health. Findings are causing some to question the amount of marijuana being sold. But as 5 News reporter Jose Carranza found out, that's not the only concern.
Around 3% of Arkansas residents are able to buy medical marijuana. It doesn't sound like a big number, but Dr. Joe Thompson with the Arkansas Center for Health Improvements presented research on medical marijuana's impact that's turning heads.
Candidly, I think this is probably the first population-based report to a public health committee anywhere in the nation.
Of the many issues addressed, Thompson expressed concerns to legislators over the amount being bought. By state law, medical marijuana card holders can purchase 2.5 ounces of marijuana every 2 weeks.
We have individuals that are purchasing 900 milligrams of medical marijuana a day for plant, 752 for edibles, 900 for vape. So this is really, if you think about a 10 milligram a dose, these are 90 doses a day that individuals are purchasing, which we clearly think represent probably not personal consumption, but diversion to other sources.
That's a real concern for me, though, is, I know I've had kids who have dropped THC vapes in the halls at schools. I've hid them in deodorant containers. That's a real thing. Kids are getting access to it.
ACHI also found that 7 physicians are certifying over a third of individuals with limited evidence of patient-physician relationship. But focused on all Arkansas physicians, legislators discussed how doctors are only certifying and not prescribing like other traditional medical treatments.
There's no clinical data, there's no study, there's no recommendations of dosage and how that equates to solving the ailment or whatever, like you have with other prescription drugs. Also, they are regulated federally by the DEA. This is a illegal substance federally, and so that creates a jeopardy for your physicians.
Dr. Thompson says that could change as federal agencies consider rescheduling marijuana and federal funding becomes available for clinical studies. But he also brings up another point to that. While physicians can't give guidelines, dispensaries are required to have pharmacists available for recommendations.
When we look at the pharmacists that are signed up, we see a few pharmacists signed up for a lot of the dispensaries, and they're almost all remote, available for a phone call, so there's no in-person kind of consultation going on with a licensed clinical individual frequently.
Covering news where you live, Jose Carranza, 5 News.
Policy considerations pitched to lawmakers today include adding more requirements to the certification process and using THC limits instead of the flower weight limit. In the last few hours, we've also heard from the cannabis industry advocate. They say many have to buy large amounts because of travel, and that the 7 doctors have created a specialty practice and developed medical marijuana expertise. There's a whole lot to unpack from this story. If you want to look through our data yourself or read the advocate's full statement, you can head to our website at 5newsonline.com.